Behavioral health conditions include substance use disorders and mental illnesses. These conditions are often the result of both genetic and environmental factors. And just like cancer or arthritis, they deserve the same compassion and urgency in treatment. Yet, people living with behavioral health conditions face stigma, blame, and fear. Too often, they struggle to access the care they need. That's why California has a safety net, built through a partnership between counties and the Department of Healthcare Services, coordinating across many different systems. At the center of the safety net is County Behavioral Health, which is an insurance plan, a service provider, and a part of county government all at once, delivering critical care to people in need, helping them find stability and improve their well-being. Every year, hundreds of thousands of Californians receive services through County Behavioral Health. They're people who are on Medi-Cal and living in poverty. They may have lost their homes, jobs, or family connections. Some may be in the care of other government systems, like child welfare services, while others may be re-entering the community after incarceration. They're adults and children of all ages. For substance use treatment services, any individual with a diagnosed disorder related to alcohol or drug use is eligible for treatment. These are people living with a chronic relapsing disease that is treatable. For mental health services, individuals must meet certain criteria. Their condition, whether diagnosed or suspected, must significantly impair their ability to work, maintain housing, care for themselves, or function in school. These are children and adults living with serious conditions such as schizophrenia, bipolar disorder, major depression, and PTSD. At its core, County Behavioral Health is a specialty system tailored for those with the most serious needs. Most people think of behavioral health care as therapy and medication. County Behavioral Health does that, but they also offer something far more expansive and urgent. County Behavioral Health works with people who are in crisis, with complex needs and situations that don't fit neatly into an appointment slot. Care begins wherever a person is, in a clinic, in a shelter, or on a street corner. For substance use disorder, care begins with helping people through the physical crisis of withdrawal, often with medication. From there, the longer journey of recovery begins. Residential programs, outpatient counseling that works around jobs and family, and peer support from people who've walked the same path. That connection often becomes the turning point. For mental health needs, counties provide therapy and counseling, but also ongoing support that helps people navigate daily life. For adults, this might mean managing a household again, reconnecting with family, or returning to work. For young people, it's about building skills to succeed in school, at home, and in their communities. It's about rebuilding a foundation, one step at a time. County Behavioral Health also meets needs that go far beyond traditional treatment. Outreach for people who are unhoused, help accessing food and benefits, support re-entering the community after incarceration, and pathways to job training or schooling, as well as prevention and early intervention services to stop these diseases before they become severe. County Behavioral Health treats the whole person, knowing that healing takes time, trust, and persistence. Like much of the healthcare sector, county behavioral health systems face significant workforce challenges. Yet, even amid shortages, the professionals who staff the system are deeply committed to the communities they serve. Across every county, counselors, social workers, psychologists, psychiatrists, nurses, case managers, and peer support specialists provide essential care and guidance. Their clinical expertise, lived experience, and cultural understanding form the backbone of California's behavioral health safety net. County Behavioral Health is actively working to recruit, retain, and support these professionals through training programs, loan repayment initiatives, and pathways for peers with lived experience to become certified providers, building the workforce that makes recovery possible. To understand how this system works, you need to understand how funding flows through Medi-Cal and the Department of Healthcare Services to support county behavioral health. Three sources provide nearly 80% of all funding for county behavioral health. First, Medi-Cal, the single largest source. It's California's Medicaid program, funded by both the federal and state governments. When counties provide behavioral health treatment to Medi-Cal beneficiaries, the federal government pays roughly half the cost through what's called federal financial participation. This is why Medi-Cal is so powerful. County funds can be matched by federal funds. Second, a 1% state tax on personal incomes over $1 million, called the Behavioral Health Services Act, or BHSA for short. Third, realignment funds from state sales taxes and vehicle fees distributed to counties. The other 20% comes from a variety of state and federal funding sources, including annual general fund support from the state. County behavioral health braids these different funding sources together. This is Alex, who's living unsheltered with untreated bipolar disorder. A peer outreach worker, paid through Medi-Cal and realignment funds, connects with him on the street. Funds from the BHSA help secure him a room in supportive housing. Once stable, he starts therapy sessions billed to Medi-Cal, with the county using realignment dollars to unlock the federal match. One person's recovery required multiple funding streams, each activated at different moments. Each funding source comes with its own eligibility rules, claiming processes, and reporting requirements. But those receiving services don't have to worry. It's the trained service providers that navigate the funding system to ensure services are provided effectively. There are other complexities, too. Typical health insurance, like the plans people get through their employer, receive a set amount of money per enrolled member per month, regardless of service use. This predictable revenue allows plans to budget and manage financial risk. County behavioral health plans don't work that way. They must use tax-based local revenue to pay roughly half the cost of services. Only after those services are delivered to eligible Medi-Cal beneficiaries and successfully claimed through the state, can counties draw down federal matching dollars. When the local economy slows and tax revenue drops, county behavioral health has fewer dollars to provide services, exactly when demand typically rises. When tax revenue increases, county behavioral health has more dollars to spend. Additionally, federal reimbursement rates vary based on who received care. County behavioral health plans both provide services directly and by contracting with providers in the community, such as nonprofit transitional housing or recovery organizations. This means counties must manage costs by running efficient clinics and negotiating contracts in a high-demand market with limited specialized providers. County behavioral health stretches to fill the gaps left by the broader healthcare system, serving not only people who are ineligible for Medi-Cal, but also those who are uninsured or underinsured, often using local funds with no federal match. Amid all these complex demands, county behavioral health continues to adapt their services and is always working to respond to changing community needs through community engagement, workforce development, and careful planning to ensure people can access services when and how they need them. Whether someone calls for help during a family member's crisis, checks themselves into a facility for treatment, or is approached by an outreach team while living on the street, they can expect to receive the quality care they deserve and the support needed to regain stability with dignity. Together, across California, County Behavioral Health meets people where they are and maintains its dedication to doing whatever it takes to strengthen the safety net, improving access, support, and outcomes for the people who need it most.